vertigo or dizziness, pressure in your ear, some loss of hearing, especially low frequency type sounds, tinnitus or tinnitus, however you choose to say it, where you get that ringing in your ear, and also nausea. What I'm describing to you is Meniere's disease. Hi, I'm Dr. Peters with Peters Wellness Chiropractic and Massage. In this week's quick video, I want to discuss Meniere's disease. And if you've never suffered from vertigo, that where you get up and the room starts spinning, except you lay back down and the room keeps spinning, you maybe got to put your foot down. And I speak from experience. I've only had it once in my life, and it lasted for less than 24 hours, but it was not a pleasant experience at all. And I want people to understand this because I've seen it a lot in my practice. It's been 14 years, and I've had, well, I don't know the exact number, less than 100, but definitely more than 20 cases come through my doors. And now the key is some of the people I was able to help and it completely went away. Other people it did not, because there can be a couple of different causes of vertigo. And well, I'm going to cover two causes. Let's put it that way. So vertigo or Meniere's disease, which is a combination of these things, can be extremely debilitating, from not being able to drive a car, not even be able to walk across a room. And then when I had it, just laying down on the bed where the room, people will describe it as the room spinning. What happened to me is the room would be like a 25% spin. It would go boom, shift back, boom, shift back. And it was really disturbing. And I was able to, for me, I was able to get adjusted. It did clear me up. I got adjusted twice and mine was completely gone. It has never returned. And it's been at least 7 or 8 years since I had that experience. I guess the good thing about it is I can totally relate when someone comes in. They'll lay on the table and say, okay, go ahead and turn over. And it will take a minute, 2 minutes for me to help them turn over because they get so dizzy and the room can start spinning. Very, very uncomfortable position to be in for the patient. And vertigo, again, can last, or the Meniere's disease can last anywhere from a few hours to a few days, a few weeks. And I've had patients come in who have suffered for this time on and time off over years for different reasons. So the two causes I'd like to discuss are, as a chiropractor, we talk about subluxations, where joints in your spine, they don't glide and move like they should. And you might have one segment that's locked up. So a good way to test, like for the neck, is just simply, stand and turn. Your nose should come over the tip of your collarbone or clavicle. You should be able to turn the same distance to both sides. If one side you can only go this way and the other side you go this far, something's wrong, right? So turning it, extending, flexing, and then going at different angles. And just see, gosh, that feels a little tight up in there. The other thing to do is just, shrug your shoulders and move them around. How do you feel? Does it feel tight and knotted up? Especially in front of a computer for 12 hours a day, right? So really paying attention to how it feels. And for me, when I had mine, I went to the chiropractor first. One, I've been going to chiropractor since I was a kid. So that's my route. That's my natural go-to thing. Almost no matter what's going on. If I had a broken bone, I wouldn't do that. But if I'm having any type of systemic issue, I am going to go to the chiropractor first. Now you may choose, because it could be fluid in the inner ear. And if you have fluid in the inner ear, it could be these ossicles. There could be different things going on. But what I tell people, listen, within 1 to 6 visits, if you're not noticing substantial improvement of getting that cleared out, then they definitely should go and see either an ENT, which is the eyes, nose, and throat doctor, or go see a naturopathic doctor, because there could be some adrenal issues and things going on that can cause it also. So if adjusting it doesn't clear it out completely, then that could be the next step. Or someone might want to go to the naturopath or ENT first, and if that doesn't work, then come see the chiropractor. But I always look at it is, your nervous system, if it's functioning better, everything's going to be better. So I always say, well, why not start with that first? Why not see the chiropractor first and get that checked? So like I said, within 1 to 6 visits, it should be substantially better, if not resolved. And if not, then obviously there's some underlying cause, and getting those things checked and having a systematic approach of checking everything and getting it cleared out to see what makes a difference for you. So if you have any specific question, please put it in the comments below. Ask, whether it's Facebook or YouTube or Instagram, wherever you're seeing this. Ask the questions. I'd love to answer them. And I got a few posts that are going out describing some different parts of this, well, what I would call possibly completely debilitating issue of Meniere's disease. So if you hear the word vertigo, you hear the word dizziness, you hear pressure in the ear, slight loss of hearing, or you hear the word Meniere's disease, think chiropractic. Think of getting your friend, your family member checked by a chiropractor to see if there is an issue in the upper cervical, upper thoracic area that could be causing restrictions and be part of this issue to cause this horrible thing to happen to them. So have a great week, and let me know if I can help you or somebody you know.